Welcome. Let's talk about identification of different types of diarrhea and medicinal treatments. Part 1. Diarrhea is defined as the condition characterized by frequent passage of abnormally liquid stools or unformed stools. Stool volume greater than 200 gram per day on Western diet. Stool volume greater than 400 gram in Indian diet. It can occur as a result of various factors, including infections, food intolerance, medications, or underlying health conditions. Diarrhea can lead to dehydration if fluid loss is significant, so it is important to stay hydrated and seek medical attention if symptoms persist or worsen. Dysentery. Dysentery is an inflammatory disorder of the intestine, particularly the colon, characterized by severe diarrhea that often contains blood and mucus. It is usually caused by infection from bacteria like Shigella, E. coli, parasites, or viruses. Symptoms may include abdominal pain, cramping, fever, and urgency to have bowel movement. Next one, pseudodiarrhea. Pseudodiarrhea refers to the appearance of diarrhea without an actual increase in bowel movements. It means increased stool frequency and stool weight less than 200 gram per day, or significant change in stool consistency. Causes may be IBS, irritable bowel syndrome, then proctitis. Proctitis means inflammation of rectum caused by ulcerative colitis, and fecal incontinence. Next one, identification of diarrhea. Identifying diarrhea involves observing the frequency and consistency of your stools. Frequency: more than 3 loose or watery bowel movement in a day is typically considered as a diarrhea. Consistency: stools that are loose, watery, or unformed are sign of diarrhea. Stool appearance: blood or mucus in the stool may indicate dysentery or another serious condition. Presence of symptoms: abdominal pain, cramping, or discomfort may accompany diarrhea. Urgency: sudden, strong need to go to the bathroom. Next one, nausea or vomiting. These can occur alongside diarrhea. Next one, fever. Low grade fever may be present, especially if an infection is the cause. Next one, classification of diarrhea based on duration. First one is acute diarrhea. Second one, subacute diarrhea or persistent diarrhea. Third one, chronic diarrhea. Acute diarrhea lasts a few days to week. Subacute diarrhea 2 to 4 weeks. Chronic diarrhea greater than 4 weeks. First one, acute diarrhea. It is characterized by the sudden onset of loose stools or watery stools, typically lasting less than 2 weeks. Most common reasons are infections and non-infectious also present. It can be caused by various factors, including infections, viral like norovirus, rotavirus, bacterial, E. coli, salmonella, or parasitic infections. Second one, food related issues, food poisoning or food intolerances, lactose intolerance. Third one, medications. Certain antibiotics and medications can disrupt the gut flora. Fourth one, digestive disorders. Condition like irritable bowel syndrome or inflammatory bowel disease. Next one, acute diarrhea require evaluation or require antibiotic treatments. First one, fever more than 39 degrees Celsius, lasting for greater than 48 hours without any improvements. Sign of dehydration like dry mouth, dizziness, reduced urination, severe abdominal pain or dysentery. Recent antibiotic use may be Clostridium difficile colitis. Outbreak in community like cholera, immunocompromised patients, age greater than 70 years. One approach to acute diarrhea. Check history and physical examination. History. Gather information about onset, duration, frequency, and characteristic of stools. Inquire about recent travel, dietary changes, exposures, and any recent illness. Physical examination. Look for sign of dehydration and abdominal tenderness. Second one, subacute diarrhea. It is also called persistent diarrhea. Diarrhea lasts between 2 to 4 weeks. It is improperly recovered acute diarrhea. It can be sign of an underlying condition and typically require further evaluation to determine the cause. Infectious causes. Bacterial infection. Some bacterial infections can cause prolonged symptoms such as those from Campylobacter or Clostridium difficile. Parasitic infections. Giardia, lamblia, and Entamoeba histolytica can lead to persistent diarrhea, especially in areas with poor hygiene or sanitation. Non-infectious causes. Inflammatory bowel disease (IBD) condition like Crohn's disease and ulcerative colitis can cause chronic diarrhea. Irritable bowel syndrome (IBS) can result in recurring diarrhea or mixed bowel habits. Malabsorption syndrome conditions such as celiac disease or pancreatic insufficiency can lead to persistent diarrhea due to poor nutrient absorption. Medications. Certain medications, particularly antibiotics, can disrupt the gut flora and lead to prolonged diarrhea. Next one, endocrine disorders. Condition like hyperthyroidism or diabetic autonomic neuropathy can affect the bowel function. Next one is chronic diarrhea. Chronic diarrhea is defined as diarrhea that lasts for more than 4 weeks. It can significantly impact quality of life and may indicate underlying health issues. Causes of chronic diarrhea. First one is inflammatory bowel disease (IBD). Crohn's disease. It can affect any part of the gastrointestinal tract. Next one, ulcerative colitis. Primarily affect the colon and rectum. Next one, irritable bowel syndrome (IBS). Functional gastrointestinal disorder characterized by abdominal pain and altered bowel habits, including diarrhea. Malabsorption syndromes. Celiac disease, gluten intolerance that lead to intestinal damage and diarrhea. Next one, pancreatic insufficiency. Insufficient production of digestive enzyme also lead to diarrhea. Infectious causes. Giardia lamblia. It is a protozoan parasite. Its infection can lead to prolonged symptoms. Clostridium difficile, often related to antibiotic use. Next one, endocrine disorders. Conditions such as hyperthyroidism or diabetes can lead to altered bowel function. Next one, medications. Long-term use of certain medications, especially antibiotics, can disrupt gut flora and lead to diarrhea. Next one, dietary factors. Food intolerance, example lactose intolerance, or excessive intake of certain substances, example sugar or alcohol, can contribute diarrhea. Next one, classification of diarrhea based on cause. Non-infectious diarrhea and infectious diarrhea. First one, non-infectious acute diarrhea. Non-infectious acute diarrhea can result from various factors that do not involve infections. Some examples of non-infectious diarrhea. First one, medications. Antibiotic. Antibiotic can cause diarrhea. Second one, laxatives, especially osmotic laxatives. Third one, chemotherapy agents. Some cancer treatments can cause gastrointestinal upset. Next one, food intolerances. Lactose intolerance. Inability to digest lactose, leading to diarrhea after dairy consumption. Second one, fructose malabsorption. Difficulty to digest fructose can trigger diarrhea after eating certain fruits or sweeteners. Next one, food allergies. Allergic reaction to foods, example shellfish, nuts, can cause gastrointestinal symptoms including diarrhea. Next one, malabsorption syndromes. Condition like celiac disease or pancreatic insufficiency can lead to inadequate absorption of nutrients, resulting in diarrhea. Next one, functional gastrointestinal disorders. Irritable bowel syndrome, IBS, can cause episodes of diarrhea often triggered by stress or certain foods. Next one, psychological factors. Stress, anxiety, or emotional disturbances can lead to diarrhea in some individuals, often referred to as a nervous stomach. Second one, infectious diarrhea. Infectious acute diarrhea is primarily caused by pathogens such as bacteria, virus, or parasites. Next one, adenovirus and astrovirus. Less common but can cause diarrhea, especially in children. Viral infections. Norovirus, highly contagious, often linked to outbreak in closed environments like cruise ships, nursing homes. Next one, rotavirus, common in children, preventable by vaccination. Next one, bacterial infections. E. coli, certain strain of E. coli 0157 can cause severe diarrhea. Next one, salmonella, often linked to contaminated foods like undercooked poultry, like shawarma or eggs, mayonnaise. Next one, Shigella, causes dysentery with bloody diarrhea, highly contagious. Next one, Campylobacter, frequently associated with poultry. Next one, Clostridium difficile, often occurs after antibiotic use and can lead to severe colitis. Next one, parasitic infections. Giardia lamblia can contracted from contaminated water. Entamoeba histolytica causes amoebic dysentery, more common in developing countries. Next one, classification of diarrhea based on inflammatory conditions. These are non-inflammatory diarrhea and inflammatory diarrhea. Non-inflammatory diarrhea often caused by viruses or non-invasive bacteria. Example like rotavirus, E. coli. Inflammatory diarrhea associated with fever, bloody stools, and abdominal pain. Example, Shigella, Salmonella. One, classification of diarrhea based on origin and stool characteristics. These are small bowel diarrhea, large bowel diarrhea, watery diarrhea, bloody diarrhea, mucus in stool. First one, small bowel diarrhea. Small bowel diarrhea refers to diarrhea that originate from small intestine, which can be characterized by specific symptoms and causes. Typically, stools may be watery and more voluminous compared to colonic diarrhea. They can sometimes be greasy or oily, especially in malabsorption cases. Low stool frequency in case of small bowel diarrhea may include abdominal cramps, bloating, gas, weight loss, and nutrient deficiencies. Common causes: malabsorption syndrome, infectious causes, functional disorders, inflammatory conditions, medication effects. Second one, large bowel diarrhea. Diarrhea due to colonic pathology. Stool volume low in case of large bowel diarrhea. High frequency in case of large bowel diarrhea. Common causes: osmotic diarrhea, secretory diarrhea, malabsorption syndrome, inflammatory conditions, certain medications. Third one, watery diarrhea, common in viral infections and some bacterial infections like cholera. Fourth one, bloody diarrhea, indicate possible inflammatory or infectious process. Fourth one, mucus in stool may suggest inflammatory conditions. One, classification of diarrhea based on mechanism. These are osmotic diarrhea, secretory diarrhea, exudative diarrhea or inflammatory diarrhea, motility-related diarrhea, steatorrhea. First one, osmotic diarrhea. It is caused by unabsorbed solutes in the intestine. It draws excess water into the bowel, leading to watery stools. This diarrhea typically resolves with fasting. Causes of osmotic diarrhea. Osmotically active substances may cause diarrhea, like glucose, lactose, lactulose, magnesium containing antacids. Lactase deficiency and disaccharide deficiency also lead to diarrhea. Non-absorbable carbohydrate like sorbitol, lactulose, polyethylene glycol may cause osmotic diarrhea. Glucose causes polyuria in diabetic patients. Lactose intolerance also lead to osmotic diarrhea. Artificial sweeteners may cause diarrhea, like example like sucralose, sorbitol, aspartate. Lactulose also used for therapeutic purpose, like prevention of constipation and hepatic encephalopathy. Gluten intolerance also lead to osmotic diarrhea. Second one, secretory diarrhea, result from active secretion of electrolytes and water into the intestine. It is often caused by cholera. It is persist during fasting. Common causes of secretory diarrhea: infectious, bacteria and viruses. Second one, neuroendocrine tumors. Tumors such as Vipoma, vasoactive intestinal peptide secreting tumor, can cause excessive secretion of fluid into the intestines. It leads to diarrhea. Third one, medications. Certain medications such as laxatives and some antacids may cause diarrhea. Fourth one, chronic condition. Conditions such as inflammatory bowel disease may result in secretory diarrhea during flare-ups. Fifth one, hormonal cause. Certain hormonal imbalances or conditions can lead to increased intestinal secretion. Next one is exudative diarrhea or inflammatory diarrhea. It associated with inflammatory conditions. Inflamed lumen exudate fluids into the GIT. It increases motility, characterized by the presence of mucus, pus, or blood in the stool. Example, ulcerative colitis, Crohn's disease. Causes of inflammatory diarrhea. Inflammatory bowel disease IBD includes Crohn's disease and ulcerative colitis, which involve chronic inflammation of the gastrointestinal tract. Certain cancers, particularly colorectal cancer, which can lead to similar symptoms. Next one, infectious colitis caused by bacteria like Shigella, Salmonella, or viruses or parasites. Fourth one is motility-related diarrhea. It is caused by increased intestinal motility leading to decreased absorption. Hyperthyroidism. Increased sympathetic activity leading to increased intestinal activity. And some prokinetic drugs also cause diarrhea. Fifth one is Steatorrhea. It is characterized by presence of excess fat in the stool, leading to bulky, foul-smelling and pale stools. Greater than 7 grams of fat per day stool. This type of diarrhea occurs when the intestine do not absorb fats properly. Causes of steatorrheal diarrhea. Malabsorption syndromes, conditions like celiac disease, chronic pancreatitis, and cystic fibrosis can lead to steatorrheal disease. It also impairs nutrient absorption. Next one, pancreatic insufficiency. Conditions that affect the pancreas, such as chronic pancreatitis or pancreatic cancer. It leads to lack of digestive enzyme lipase. This leads to the diarrhea. Pancreatic lipase is an enzyme produced by the pancreas that plays a crucial role in the digestion of dietary fats. Deficiency of it affects the fat absorption and fat-soluble vitamins, micronutrients absorption also. Thank you for watching. Identification and treatments of diarrhea in part 2.